We need to create a PPP, a public-private partnership with state government, with federal government, with regional government, with the African Union to establish research centers in various regions and, of Africa, the Eastern region, the Western region, whatever, the North and all that. We need to have research centers. We cannot be relying on the Western world and other people, the Middle East, for them to supply us with what we need. We need to start preparing from now.
Hello, everybody, and welcome to today's edition of Unpopular Opinion. We are going to be discussing a pressing issue that is affecting the entire continent. The CDC Africa has declared Mpox as a pandemic for the African continent. What could that mean for African, and how could we fight back as people from Africa? Today, we are joined by Dr. Kumi, who is a public health expert. He's an advocate for quality health in Africa. He holds a doctoral degree in epidemiology. Before we turn the platform over to him, we encourage you to please subscribe to this YouTube channel so that whenever I post similar contents like this, you'll be among the first people that will be notified. As algorithm and statistics have indicated to us that 60% of our viewers are subscribers to this channel, and we encourage the remaining 40% to subscribe to this channel and our new viewers as well. Dr. Kumi, welcome to the Unpopular Opinion, and feel free. The floor is yours.
Thank you very much. Once again, it's a pleasure being here with all of you. It's exciting to be invited to this Unpopular Opinion, where we discuss issues affecting the African continent, of course, issues affecting the world in general. My name is Komi Lesi Saturday. I'm a medical doctor, a physician, board certified. I've also lectured in universities, both in Germany and also universities in the United States. So I've also lectured courses varying from basic medical sciences to some advanced level courses. And of course, I'm a health enthusiast, a consultant to the public health field, and someone that is passionate about the continent of Africa. And today we have a very important and interesting topic to discuss. And once again, kudos to the team behind the Unpopular Opinion, because this is really, really a topic that I think should be on the front burner of all networks in Africa, shedding more light and giving more visibility to this very critical topic regarding Mpox, right? Because it's really, really a concern, and I'd like us to delve deep into it. So please, like you said, subscribe to the channel, share the link to your friends, and ensure that your people, get to be enlightened on this very significant, important topic. So let me start from the basis. It was previously known as Monkeypox, and of course, that is it is quote unquote racial, right? Because we all understand. So those of us that trained in the Soviet part of the world understand that when racists in quotes want to insult someone with a black or brown skin, they call you monkey. And of course, attributing this condition to monkeypox gives some sort of prejudice to those with the black or brown skin. And so far, the World Health Organization thought it wise that it's important to change that name from monkeypox to Mpox. And I give them kudos for that. Well, let's start again from the basis, why it was called monkeypox, and why I have some issues with the name monkeypox. We all understand that most of the medical conditions in the world today, we have Japanese encephalitis, we have German measles. There are some medical conditions and even some animals that are named according to the regions where they have been discovered. It will interest you to know that monkeypox was first discovered in 1958, not in Africa. And I want you to know that. It was discovered in Denmark amongst laboratory monkeys that were kept in the lab, for some laboratory processes. And then the laboratory guys found out that they have some pox-like symptoms, on their bodies. And they decided to research further. And it was there and then they discovered that these particular monkeys have a pox-like disease, and they decided to call it monkeypox, not Denmark pox. I'm not encouraging it to be called Denmark pox, but I just want everyone to understand where it started from. And guess what, guys? This very highly contagious disease, this very highly infectious disease, discovered in 1958 amongst laboratory animals in Denmark, was first seen in humans in Africa, in the Democratic Republic of Congo in 1970. And I asked myself, how did this happen? Miraculously or whatever. It was discovered in Denmark. It wasn't called Denmark virus, and it was not transported. I don't know. I'm not saying it was transported, but it was not found in the first human in Democratic Republic of Congo in 1970. All right. And there and then, that disease was, quote unquote, we all understand, we all know what the word on the street was seen as an African disease, as an African virus. So again, I want to challenge all African health professionals. We have to be vocal about these things. Africa is not a second world country. I want to give this general overview before I get into the virus in detail. We are not a second world or third world country where diseases and conditions that are found in other places would not be named after Africa in a very derogatory manner. I stand against that. I completely stand against that. But anyways, it was found in a human form in the Democratic Republic of Congo. And then again, we discovered after some time with the scientific progressions and all that, that the disease, the monkey is not the primary carrier of the disease. The monkey was just one of the people that happens to have contracted the disease from the family of rodents. You know, we are talking about rodents, we're talking about rats, squirrels, and, you know, what they call the Gambian giant rat, which again, you see, they are very easy with the world to call it Gambian giant rat. But okay, we won't delve into that right now. But again, yeah, so these rodents are the primary carriers of this virus. And then this virus was transmitted into the monkey. So that's the understanding that we have regarding the laboratory animals that were infected and found in Denmark. Now, this particular virus called the Mpox, and I want us to change the name. In fact, the M there should be removed completely. We should look for something else. But anyways, this Mpox virus is part of the family of the automyxoviruses. And since our audience is a blend of both medical and non-medical people, I wouldn't want to break it more down into detail, but it's part of the family of automyxovirus, the poxviridae viruses, of poxviruses, and which also, let me break it down to something that our audience might understand, from the family of the variola virus, the virus that causes smallpox. We'll understand how smallpox was devastating the world and how smallpox was eradicated in quote in 1980, and you know how that became a scientific miracle, right, all over the world. Of course, we still have tiny pockets of cases here and there, but we're able to overcome that. So the Mpox virus is from the family of the automyxovirus, the poxviridae, which is part of, you know, the family of smallpox. And that's why their symptoms are very, very similar. We're going to discuss that in detail as we go on. So this is what, or the group where the virus comes from. Now, the virus have two strains or two subtypes. It can be further divided, but we'll just base our conversation on the major two subtypes. And we have what they call, or what is referred to as the Central African clade, or what they call the DRLC clade, or the Congo clade, and the West African clade, or West African group, or West African strain. Apparently, the West African strain is the less severe form, and that found in Congo is the more severe form of the virus. And how is this virus transmitted? Mostly, it has been said that the virus has been seen and scientifically proven that this virus is transmitted, but it's a zoonotic virus, so it can be transmitted from animals to humans, and that's why it's very, very serious. So it transmitted from contact with infected animals, talking about rodents, rats, squirrels, and the Gambian giant rats, and some other, rodents and all that. Sometimes when hunters go on the farm, they go with dogs, they go with these, they go with different animals. And then you get in contact with some of these other rodents and, you don't know how, they can penetrate your body something and they are infected. And then, the infection is being transmitted. And it's important for me to note here that these rodents, rats, squirrels, and all that, they are asymptomatic when they carry the virus. So they can be infected, but you cannot notice it. So that is why this condition is very, very serious. Because some people have rats in their house, either as pets, or whatever. And then you might have some casual contact with this pet. You don't know if they're infected with this particular virus. So that is why it's very, very important. So it's a zoonotic virus, so transmitted from these animals to human. And it's also transmitted from human to human. But the human-to-human transmission is a little bit less severe, less frequent, because it needs a very close contact. So for a human to transmit this Mpox virus to another human, it needs a very close contact. And in that case, we're talking about, for example, the contact with the lesions. We're going to discuss those symptoms in a few minutes, but we're talking about contact with the skin lesions. So with this virus, you have a lot of lesions. So contact with those lesions, respiratory, I'm talking about when the person breathes and when you stay with a person for a long time, there's what we call respiratory droplets. So there can be some transfer of those respiratory droplets and the other human can take it in, and that can also be a means of transmission. There is also transmission, particularly when you use beddings or clothing or objects or instruments that someone that has been infected has used. And this is why I emphasize all the time that when you go to hotels, when you go to anybody's house for sleepovers, whether it's your girlfriend, your boyfriend, ensure that you inspect what you're sleeping on. It's important because when you sleep on beddings in hotels or use towels from hotels, and someone that used it previously, mind you, that some hotels tell you they clean it, but that's not true. So imagine you use a towel that someone that was infected previously uses, and you remember that we have some small lesions in our body that are not very notable and are open to our blood vessels. So when you use those towels and scrub your body like some of my brothers and sisters do, scrub your body very rigorously, it can transmit some of those fluids that have been accumulated from that material into your body. And that is another means of this virus being transmitted. Again, this virus can be transmitted from mother to child. So a pregnant woman with this virus, unfortunately, can transmit it from herself to her child. So there are various means. And again, it is more found. Remember, I'm not saying it's just within those group of people, between people that gay couple, men that sleep with men. So men that have sex with men, we call them MSN, men that have sex with men. So this particular infection is more found amongst this community. And again, I ask another question. If you're talking about the places where there are a huge number of men that sleep with men, I don't think Democratic Republic of Congo or some parts of West Africa is endemic or has this population. So again, I have a question on what the epidemiological study of, rating this disease has been very prominent in Africa, where they got it from. And lastly, another means of transmission, again, is through eating and cooked meat. So again, our people are very good hunters. So when they go to hunt, some people just hunt, shoot, and just roast it in the farm without it being properly roasted, and they eat some of those meats. Remember, I said it's a zoonotic infection. And again, some of these rodents can transfer it from, themselves. And then when you eat those meat, it's a real issue. And I will mention, and not to be, prejudiced against people that eat dog meat. It's important that you note that the first time that this disease in April 2004, 2003, that was discovered in America, it was in a dog from Ghana. Apparently a dog from Ghana, because the world is, globalization, the dependence of different countries of different traits and all that, a dog from Ghana was kept alongside with rodents that were infected. And of course, the dog was infected. I think it was a prairie species or something like that. And it got to the United States. And it is from that the infection first appeared in the United States. So Again, those that eat dog meat, it's important that you're very careful when you're doing that. I have no prejudice against you. Don't forget, I mentioned sexual intercourse. That includes oral sex. It can be oral. I'm using demonstration because I believe I'm talking to adults. So oral sex, either with the mouth here or, whatever, the other way around. Okay? When you have deep oral sex, or what they call French kiss, for a long time, some people have French kiss for 25 minutes non-stop. If your other partner, unfortunately, had Mpox, there is a likelihood that you might contract it, because sometimes these lesions are found in the oral cavity. Of course, it's not common in children to be found in the oral cavity, but it's also very common in adults as well. So I'm not saying when you're kissing your partner, you try to look, but please on the light so you are very sure of it. All right? So you don't go and control what you don't know. No, I mean, if you know your partner, you know what's going on. So let's move further to what are some of the symptoms of this condition. The common symptom, fever is the first thing. So after the Mpox the virus gets into you, into not you, but somebody else, not somebody else, into the devil. When it gets into the devil, what happens is that it has an incubation period between 5 to 21 days, sometimes 7 to 14 days, as the case may be. And then replication, because it's wicked, it starts replicating and start producing like an idiot. And once it starts producing and replicating, it stays there to arm itself. When there are a lot, what happens? They start creating a lot of trouble in the body. First, you have headache, you have fever. You think, oh, why am I feeling feverish? So those are signs, similar signs of viruses that are part of the virus family. So you start having fever and all of that. And then headache. And then you have body ache, muscle ache, back pain, weakness, right? And another one that differentiates it from all the other smallpox and the rest is lymphadenopathy. So you see, sometimes I have boil in my armpit. Sometimes it's not boil. That is lymphadenopathy. So lymph nodes are swollen. So you see lymphadenopathy, swelling of all types of lymph nodes around the body. That is what differentiates it. So when a physician sees a patient, apart from the rash, which is the next symptom I'm going to talk about, once they see lymphadenopathy and some of the rash, and they do clinical and laboratory testing, they will find out, or they will confirm that it is Mpox virus. So the next symptom is the rashes, the characteristic rash that is being seen. So this rash typically starts from the face and then spreads all throughout the body, to the palms, to the sole of the feet, and of course, even the genital region. To tell you how this virus is wicked, it spreads to the genital region. So again, the rashes have different phases. We have the macular phase, where it's just flat and differentiated colors. We have the papular phase, where it's just swollen, grown, and strong and rigid. We have the vesicular phase, where there's a clear fluid in it. And then we have the postular phase, where there's a pus in it, right? And then this pus would open and then spread and become a crust and all that. So you see that over the body happening over and over and over again. So when a patient sees that, or a physician sees that, and then lymphadenopathy, they will send it in for laboratory testing. So these are some of the basic signs and symptoms that someone would experience. So what are the clinical testing that needs to be done? Now, once you see this, I advise people, don't do self-medication. Please, I beg you, don't do self-medication. When you see this pus on your body, don't cut it, don't prick it. Please, go to a hospital, the hospital near you. Call a doctor, start something. Don't try to self-medicate. So what are the ways of testing? First, we do clinical testing. It means your physician is going to look at you, look at the lymphadenopathy, look at the, the rashes and all that, and take your history. And then after that, we'll send you in for laboratory testing. We'll do what we call the PCR, the polymerase chain reaction. It's a test that checks for the DNA of different viruses. So we send that in, get the result, and then we'll determine if the patient has Mpox or not. How can Mpox be prevented? Now, Mpox can be prevented in various ways. One, avoid contact with just random people. Those that have multiple partners all over the world, You see someone from Angola, you see somebody from Japan, you see somebody from here, you want to have something to do with it, you're going to be at high risk. Those within the spectrum of, MSM, men that sleep with men, gay couple, it's also another challenge, particularly those that are not faithful to their gay partners, right? It's also another condition. Those that have excessive, French kiss and oral sex, I have a concern with that. You also have some concerns too. Those that use bedding, prevent yourself. Come with an extra bed sheet and all that. Those are preventive measures. Of course, we have vaccination, which I think is an important thing to talk about for the African continent. There are vaccinations. We have the vaccine that was used for, smallpox. It has 85% success rate in people that use in preventing Mpox, right? Because it's not specifically for Mpox. It is for smallpox, but of course they are from the same family, right? That's what most countries are using now. But of course, there's a new vaccine that is specifically for Mpox. It's called Invasim, which is currently used for Mpox. It's widely used in the United States. They have a lot of doses of those vaccines here, and they're giving out to people to prevent the spread of Mpox. Of course, there are also medications that physicians usually give, like the TPOX, which was primarily for, the Mpox, for the smallpox, but we give it for those with Mpox when we see those signs and symptoms. But overall, I want to encourage you. That's why I don't want to go a lot into the treatment strategies, because I know if people want to see that, they go and get it. I don't encourage you to go and do self-medication. Report yourself to the nearest clinic and let the doctor see what they can do. Just a few days ago, now diving into the African continent, because this is huge. I personally think that, with all due respect to what the WHO and all the health organizations are doing, I think they are being very unfair to Africa. I saw a few days ago, 10,000 doses of this vaccine was given to Nigeria, a country with over 200 and something million population. Only 10,000 doses. And we are very, very close. We are in West Africa. We have a second strain of the virus named after our region, and we are getting only 10,000 doses. And so this is a wake-up call for all African healthcare professionals and, of course, the investors in the healthcare industry. We need to have institutions that can encourage Africans to produce this vaccine, because I think that was a slap to the face of Africa. What is 10,000 doses of vaccine in a country like Africa? You cannot, in Nigeria, you cannot even use that in Lagos, for example, or even in my village, we have 25,000 plus. So it's of no use. It's like literally no use. And the same thing in the continent of Africa in general. We know the case with what happened with the COVID-19 vaccine. There are a lot all over the world, but not enough in Africa. When you compare the doses of these vaccines available in the United States, I don't want to mention the amount. So I think it's very disproportionate the way this is being done. And African healthcare professionals need to start understanding that we cannot depend on the world for everything. If you check those that are producing these vaccines, most of them are from the African continent. Most of the people on the team. Why are we relying on the world? Why can't we invest in industries and laboratories and, in R&D, research and design system that can help us produce such vaccines? Must we depend on Pfizer, Johnson & Johnson, and the rest? Why can't we have ours? COVID-19 happened. China produced their own vaccine. They had their own companies that did that. Where are the companies in Africa?
Thank you very much for the deliberation. And I think it was quite interesting deliberation that you've made. And I'd like to ask you my first question. According to World Health Organization, about 40% of the population in Africa or in sub-Saharan Africa have access to vaccination. So what can we do, or people like you can do, for us to be able to increase that number from 14 to at least 50 to 60% in order for us to be able to reduce infant mortality death? Because according to the same World Health Organization, it says that 10% of the children born within this period are likely to die because of Mpox. So what can you say about that?
Thank you very much. It's very sad, because most of the deaths recorded in Africa are children, right? Because young children or young people, pregnant women, and those that are immunocompromised are those that are highly susceptible to this virus. And that's why I'm very, very tense and passionate about this. And again, a meager 14% of a population that is over 1 billion, you can see that we have a huge problem at hand. What I want us to do, my suggestion, and that's always been what I've been saying to my colleagues, we need to create a PPP, a public-private partnership with state government, with federal government, with regional government, with the African Union to establish research centers in various regions and, of Africa, the eastern region, the western region, whatever, the north and all that. We need to have research centers. We cannot be relying on the Western world and other people, the Middle East, for them to supply us with what we need. We need to start preparing from now. We need to start investing from now. You don't prepare at the battlefield. You prepare before the battle begins. So from now, before any other issue comes up, we are always reactionary in the African continent. We need to be proactive. So the ways I suggest is, if every country cannot do it, regional government should do it. We have the ECOWAS. ECOWAS should come together, have a standard research centers in this region. We have the Central African region. We have the Eastern Africa. We have the Southern Africa. We need to have standard research centers. We can partner with, research centers abroad to improve what we are doing, but we should be able to produce our own, what can actually service us in Africa. We have people that have the resources to support us. We have the human resources, people that have the ideas. Trust me, I went to Harvard University, and you will be shocked the amount of African professors and scientists of African descent that are doing wonders. You go around America and you see Africans, professionals of African descent that are doing wonders and are ready to come and contribute to Africa. I give you an example outside the medical field. The founder of supercomputers, Philippe Megwali, is from Nigeria, the man that was behind what we're using today as the internet, but he's sitting in America. What can we do to bring these brains to Africa in the healthcare sector to do something wonderful? I'm sure you've heard also of the American Nigerian physician that was operated on a woman, brought out the fetus, and was able to do some repairs and put back the child, and the child was delivered at term. We have the human resources. We have also the financial resources. If not for bad leadership and corruption, I think we should be able to establish this research center. If we do that, we'll be able to produce what Africa can consume. And trust me, we'll up that number from that 14% to even up more than 70%. So we can do that. We can be able to invest in this research, get our people to start researching in these areas, have centers, apart from research centers, have institutions that train our people, focusing on research, focusing on problem solving. I think with that, we can get it done. And we are too dependent on WHO and for them to give us handouts. So that's the problem. Thank you.
Okay, doctor, thank you for that explanation. Given your expertise in epidemiology, I'd like to understand what are some of the most critical measures that need to be put in place right now in order for us to be able to curb or curtail the spread of this disease in Africa.
Great. So one of the major reasons where we have increase in morbidity, that's increase in amount of disease spread amongst the population, and increase in mortality, one of the ones that is really personal to me is the access to quality health. So there is poor accessibility to health care. If you go to the WHO website, you're going to see that they said that the regions or the communities in DRC where this virus is very, very present have little or no access to quality health. And that's why it is difficult for them to contain the virus. So again, we need to create accessibility to quality health care. Nigeria, for example, has a population of over 200 million. 49%, 48% of the Nigerian population live in the rural areas. And that's just little, if it is 200 million. So something around 80 million population of Nigeria live in the rural areas, for example. And in the rural areas, there are little or no access to quality health care. So you can imagine the problem that we have at hand. So we need to increase the accessibility to quality health. How many primary healthcare centers do we have in the rural areas? How many healthcare general hospitals do we have in the suburban areas? Okay, for some of these specialists, if we have shortage in specialists, how are we improving on that? How are we using telemedical approaches to solving these issues? I've said it time and time again. Africa is a multi-ethnic, multilingual society. We cannot use the system that is, functional in America or England and just copy and paste it in Africa. It's not going to work. We cannot use the same system. So one of the things that I think can work for us to increase accessibility is using the telemedicine. We have access to internet. A lot of millions of Nigerians are connected to the internet. You can see that on Tunde's page in the comment section. You can see how many people are typing per second. So it means they are connected to the internet. So if we have satellite telemedical centers in the rural communities and have a healthcare professional sit down there so that people that have symptoms, uncommon symptoms that they cannot understand, if we cannot physically have healthcare centers there at the moment, we can use these telemedicine approaches. So they have a communication over the internet where doctors can be able to ask them questions, see their symptoms, and if it's something that is important and urgent, like Mpox, and of course, maybe COVID, we can send healthcare professionals there to carry out the first aid and do the right thing. Again, one of the major complaints that our government and other healthcare agencies say, lack of resources. There is never going to be enough resources, and that's the news I have to bring to everybody. Provided you're on there's not going to be enough resources. There's nobody that says we have enough resources. There's never going to be. We can build tent hospitals. We did that during the COVID-19 outbreak in Lagos, and it was a success. We did the same thing during the cholera outbreak, and it was a success. Why can't we replicate that? We can say, okay, it's going to take us 6 months to build healthcare centers. Why don't we have tents in these rural communities? These people deserve quality health care. Health care is a fundamental human right. You are supposed to have health care when you need it, where you need it, how you need it, without suffering any financial, issues or challenges. That is a fundamental right of every human being, whether you are in Africa, you are in Tokyo, or you are in America. So again, accessibility to quality healthcare. We mentioned pregnant women and children. How many pregnant women in Africa goes to antenatal? In most cases, they are scared they need to pay some money, and these women are farmers. So how many healthcare centers are devoted to these women and to these children and are giving quality health, not just having a healthcare center where a doctor is not going to be there and you send a youth corporate doctor that needs supervision and training to come and supervise, to come and carry out healthcare screening and all that. That is not quality healthcare. We're talking about when you have professionals that have been trained, giving the people standard top-level care. You're not supposed to have quality healthcare based on the money you have. That is not what the fundamental human rights state. You're supposed to have the quality healthcare when you need it, how you need it, and where you need it, irrespective of how much ego or money you have in your pocket. So again, we need to address this, and if we do that, we're going to up, the standard and the way we've handled this so far.
All right, Doc, thank you. That brings me to my next question, which is, what role do you think technology and innovation can play in improving healthcare infrastructure in Africa, especially when it comes to outbreak of diseases like this in the areas of diagnosis, improving surveillance, and treatment across the continent? What role do you think technology plays?
Interesting. I did a program, a short crash course on this particular point you mentioned. So I think it's very important. I'll pick up on surveillance. In the United States, for example, and even in Canada, when someone has COVID-19, when it was really COVID-19 and, it was everywhere, you can actually, just by downloading an app on your phone, know if the person ahead of you has the virus or not, or someone in this area where you're visiting has the virus or not. And healthcare professionals can be able to track the person or who has the virus, because you cannot be diagnosed and keep it to yourself. The system must be able to update that. So it's important because, again, the reason why this is spreading is there is no accountability. There is poor surveillance. So technology and innovation has a huge role to play in surveillance, in treatment and diagnosis. PCR, for example, is what we are using right now, but there are a lot of advanced technologies that can be used. Again, there are a lot of advanced technologies that can be used to protect and prevent any area, that has these viruses in Africa. So what I would suggest is the African leaders or healthcare professionals or hospitals or healthcare ministries and parastatals invest a lot in innovation, invest a lot in technology. Whether we like it or not, technology is here to stay. And in the few years from now, a lot of medical processes will be AI powered, right? It is already, being done in America. It's even done with the telemedicine approach. So I think it's something that rather from, distancing ourselves from it, we should start embracing it. And again, I say it again, these are facts. Most of the people behind some of these telemedical approaches or some of these technologies are people from the African descent, working in collaboration with their partners from all over the world. Why can't we create an enabling environment for these technologies to be properly used in Africa? We saw some comments from world prominent people during the COVID-19 period, and we don't want that again. So as someone that has vast experience in epidemiology and I've, seen so many cases, both in person on the field and also in writing, I would suggest that if possible, every country should come up with a system on how to properly survey and, check people that have various viruses or various conditions that have the tendency of being a pandemic, epidemic, or whatever. In that way, we can be able to, manage and contain viruses when they spring up. Else, we are going to have a huge issue in our hands. Look at what cholera did a few months ago in Lagos. If not for swift intervention, it would have become a national disaster. Now, Mpox has been found in Rivers State, and it just one isolated case. But trust me, because of poor surveillance, I'm sure that there are multiple cases in the state. There are people that this person have contacted, have interacted with, that this virus has spread. But again, poor surveillance and poor reach, we cannot be able to account for these people. And with that, when you have these poor systems in place, you have a huge issue at hand. So, you answering your question, technology has a huge role. We cannot do without technology in this age. And again, the system in most countries in Africa where there are poor, documentations of people, I'm talking about healthcare data, electronic healthcare records, we literally don't have that in most countries. We need to start working and getting used to electronic healthcare records, because by doing so, in most clinics in America, you can transfer, you are permitted in some cases to transfer the healthcare record of one patient to another hospital. There is a system, there is a loop, but we don't have that in most healthcare centers in Africa. Are you going to carry the paper from hospital A and travel to ECMOMA to go and show somebody in the next hospital? It's not going to be efficient. Or I'm traveling to Gabon, I'm going to carry my paper record to that place. It's not going to be efficient. But if it's being done in that loop within the hospital system, we can be able to first survey and then provide adequate care for those patients and isolate people when necessary. So, in my opinion, we need innovations, we need creativity. And now, again, innovation boils down again to investment. Because how can you be innovative when there are no investments in that? We must be intentional about it. And that's what is lacking in the system. I say it again and again. We cannot just cherry pick and copy what is happening in other countries and just implement it in Africa. We use African solutions to solve African problems because we are unique people with multi-ethnic, multilingual, multi-whatever. That we have to use the African approach. So innovation, we're talking about innovation, not innovations that work just in other places, but an African-centered and African-focused innovation. And that's why our leaders and our healthcare team need to invest in that area. And healthcare professionals like myself from Africa, we also have a role to play, either in area of enlightenment, either in areas of advocacy, or either in area of contributing our human resources, our intellectual resources to help in the process. We have a lot of work to do. And I think technology, like you said, we wouldn't have this conversation if not for technology, right? Most people wouldn't be able to interact with us, ask us various questions from different parts of the world if not for technology. I've interacted with patients from even Burundi, the war-torn Burundi. If not for technology, that wouldn't be possible. So it's important.
My next question is, in your opinion, what role do you think the international community, such as the World Health Organization, the Africa CDC, or the African Union, or the ECOWAS, can play in supporting African countries' health system in order for us to be able to fight against this disease? And what can we do as people or as countries or as governments to stop the repetition of this mistake? Because we witnessed the outbreak of Ebola in West Africa in 2014. I think it was catastrophic because I lived there at the time, and I did not experience Ebola, but I live within a community that was heavily affected by Ebola. So I lost some of my friends, and I lost people that I knew within my community. What can you say about that?
So sorry to hear that. I mean, we lost so many prominent Nigerians. I think we lost Professor, uh, the former head of NAFTA. A very vibrant lady. No, we lost a doctor rather, not the former head of NAFTA. A doctor that was, that had interaction with someone that had the virus at the time. A prominent doctor in Lagos. We lost other people as well. So sorry to hear that. Again, there's so many things to do. First of all, the WHO is good, World Organization. It's not, we have to understand as Africans that they are not just focused on Africa to come and help us. Again, there are people that donate heavily to these organizations. There are people that support them. And whether we like it or not, they are going to somehow support. And, they have, without any prejudice, I'm not saying anything against the WHO, but of course, they are not just going to direct all what they have, their resources, and all to Africa, right? So we have to first establish that. Now, the second point is African content, we are too enriched. We have a lot of, like I said, human resources, financial, whatever, we have it. It is just poor leadership. All we do mostly in Africa is just politics. Politics have become a career for our people. You see young people 21 years just want to go into politics. I follow the AU and the ECOWAS, news and all that. It's rare for you to see or hear them talk about healthcare of, the region. So what I think the African Union and the ECOWAS, and of course the ECOWAS chair at the moment is the president of Nigeria, what I think that they should do at the moment is have a little bit more focus on healthcare. We need to talk about it. I think it's embarrassing and insulting to people of Africa that when issues about pandemics and all happen, they start thinking first about Africa. They start restricting Africans. Imagine how many countries of the world stopped Africans from traveling to their countries during the Ebola outbreak and during the COVID. Some other countries were still able to travel somehow, but people from Africa were greatly scrutinized. It is an insult to those people. It's an insult to us as Africans. So I think our leaders, the African Union leaders, the ECOWAS leaders, have a deep role to play. I am not sure there is anything known as the ECOWAS or African Union Health Initiative. I'm not sure there's something like that. Maybe they might have a chair in charge of health, but what has been the impact so far? We have WHO regional chairs all around Africa, but I'm sure if I should ask an audience here, do you know the WHO regional chair for Africa? I'm sure they don't know. Or the WHO representative of Nigeria or some other, I'm sure they don't know. These are just titles and just names to advance in careers and all that. But that is not what Africa needs. And again, I hate this idea of just pulling up statistics and graphs and all that. That's not what will work in Africa. We need to use the African solution. So again, we need to create a system where every country, region, and the African Union is accountable to have people in the area of healthcare. African Union needs to put out a legislation and a policy and say you cannot budget below certain amount of money for healthcare for any country within Africa. It is important. We need to set that. The last time I published on my platform, how much was the healthcare budget of Nigeria vis-a-vis how much other countries of the world have budgeted for their healthcare? And it was a far cry. It was a far cry. If you check how much each Nigerian has from that budget of healthcare, I think it was about, is it $60-something or $100 and something? when other countries, their counterparts in other parts of the world is having $2,000, 1,500 in Australia, in Canada, in America, and all that. But Nigeria is having 60 something dollars or 20 something, whatever. How much is that going to cater for you? And that's annual, that's in a year. How much a Nigerian is budgeted for healthcare for each person in Nigeria? It's poor. So the AU, the ECOWAS Union, the South African, Eastern, whatever, need to come up with a policy. You cannot budget this much, this lower. In Nigeria, for example, governors are having security votes that are going up to billions of naira. How much is the healthcare budget for your state? This is the problem. So again, this needs to change. And again, I think again that the treatment of healthcare professionals, with all due respect to to different countries across Africa, I think is quite poor. When you check the remuneration or the take home for healthcare professionals, comparing that to their colleagues in other parts of the world, it's very sad. Even if you want to localize it based on the currency and all that, I have a colleague that's receiving 120,000 naira every month. It's less than $100. And you expect these professionals to pay for expert courses abroad. You expect him to go for international medical conferences to get the knowledge on how to address issues in Africa. And then you are paying him 120,000. He has wife and children. He has a car to service. He has a house rent to pay. He has healthcare bills to sell. How are we going to improve on the healthcare system there? Because what you have professionals that have little or no, current knowledge on expansion, because they are not traveling to have this, international experiences, and they have to handle cases, based on what they've had, their residual knowledge. How then are we going to advance? So we need to tackle this issue. It's a multifaceted issue. So we need to tackle it from everywhere. It's just like an elephant. If you touch the front, you touch the back, you touch the side, you feel different things at different points. So the treatment of healthcare professionals needs to take in place. Adequate policy needs to be taken by AU and ECOWAS. Every country also needs to have a responsibility. And disciplinary measures must be put in place by AU, ECOWAS, and all the unions. If you go against this, it's important. Because again, a country or a region where the people are sick, it affects the economy, it affects the GDP. When a lot of people are sick, less people buy food, less people pay for taxes, less internally generated revenue, and less growth for the country in terms of GDP. So what are we talking about? It's beneficial. It's a win-win situation for both the government and the people.
Okay, Doc, thank you. That brings me to my next question, and I'm sorry that we are coming to an end of the discussion today, and it's really quite interesting one. But I'd like to ask you, I think, 2 questions before we go. Second to my last question would be, I'm going to take you from the policy aspect, because we talk about the historical aspect of the pox, and we talk about the contemporary issues regarding it, and we also talk about various treatment methods. But now there's something that I should have asked earlier on and I didn't ask, which was which people or which category of people are mostly at risk of contracting this virus?
Very important question, and thank you for drawing my attention to that. One of my passions is to see how we can reduce infant and maternal mortality. So one of the highest group of people, apart from the other groups which I'm going to mention, is infants, because I have a lot of interest in that. Infants, children, and mothers, pregnant women. Now, the reason for this is they have low, their immune system is a little bit lower. In infants, their immune system is just developing. It takes some time. So they have, low immunity, and then the virus easily attacks them. The same thing with a pregnant woman as well. So it's important to note that this group of people also have higher susceptibility. Now, men who sleep with men, MSM, gay couple, intersex, whatever, those that have sexual intercourse through, other means are different from, the vagina, and I'm talking about anal sex and other types of sex, because there are various ways right now, trust me. So these are also one of the highest groups of people, particularly men who sleep with men, because the disease was found mostly amongst men who sleep with men. But then again, we don't want to stigmatize this group of people and, try to tie the disease around them. So it's important for us to know that the disease can affect anybody. It is not just for men that sleep with men. It's not just for gay couples. Again, those that are immunocompromised, like those with pre-existing conditions like HIV, those with some forms of cancer and are undergoing chemotherapy. So when you are undergoing chemotherapy, you take, for example, statins, and try to, reduce your immune level because they are trying to kill the cancer cells, right? So again, that reduces your immune level, and at the same time, improves your success or increases your susceptibility to infection. So those with any of these autoimmune conditions are conditions where your own immune system, your own agent that's supposed to fight external diseases, start attacking your own body. So various autoimmune conditions, people that have that also have higher susceptibility to having these conditions as well. Other groups of people, farmers, for example, those that live, with these rodents and animals. We know in our villages and our farms, I've seen people that have rabbits as their pets in their house. And in this modern age, we have seen people that have, rats as, what they call it, as their companion or whatever. So those that have some of these rodents and animals and live with them or are very close to farms and farm regularly also have an increased chance as well of having this condition. Those that live in crowded areas, we understand that there are some people that live in buildings and neighborhoods. We call it face me, I face you. Those that live in those kind of packed up environment where 8 people live in a room of one, is a room where 1 or 2 persons are supposed to originally live, also have higher chances because, and these are epidemiological conditions, statistics, because when someone has the condition, for example, remember I stated that incubation period can be somewhere between 5 to 21 days or 7 to 14 days. At that time, they don't know. They are asymptomatic. They don't have the symptoms. So once they start having the fever, when they start having the headache, they also don't know exactly that they have it. And when you live in those congested rooms with them, there's easy transmission of this condition. People that have multiple partners, sex workers, what we call locally in Nigeria, hookup, ashawo, all those things. No disrespect intended. Yeah. So people that are sex workers that sleep with so many people or have sex with multiple partners also have a higher chance of developing, of contracting this condition. Because like I said, most people are unaware that they have it. And again, remember, like I said, people can have sores or lesions in their mouth, and you may not know. It's not everybody you are interacting with that you say, open your mouth, right? People just have it and say, oh, I have a little cut in my mouth. Probably the person has it and did not know, just like a lot of people are, had the condition and did not know. So in general, these are the groups of people that have higher susceptibility. I don't want to say those that live in Africa, those that live here, because everybody anywhere can actually be, susceptible to the condition.
I think we coming to an end of today's edition. So, but before we take a leave of you, I want to ask you if there's something that you want us to talk about, or there was a question that I didn't ask, or anything that we did not talk about during the show. Do you care to elaborate on that?
All right. The only thing is, I want to say that people subscribe to Unpopular Opinion. Please ensure that you support what these young men are doing. They're giving more light to, issues that are very sensitive issues across the continent and, of course, across the world. We have very few people that are doing this in this age of social media, comedy, and all that. There are very few people that focus on some of these very key, important issues, like Unpopular Opinion is doing. So encourage them, subscribe, like, give them a thumbs up, suggest topics that they should talk about, just like the wonderful topic we spoke about today, and ensure that you protect yourself from being susceptible to some of this condition. Like we say in Nigeria, prevention is better than cure. Or we say it all over the world, not just Nigeria. Thank you very much.
Thank you very much, Doctor. It was really an interesting discussion with you. And we look forward to having more discussions like this with you in the future.